Hey, welcome back to Not So Complicated, and today we will be studying about trochlear nerve in our episode 4 of neuroanatomy series that started with cranial nerves, right? So let's begin from the root or origin of the nerve. So it actually originates in the trochlear nucleus. The precise location is that it lies ventral to the cerebral aqueduct located in the midbrain, and that lies at the level of inferior colliculus, just below the oculomotor nucleus, right? So that is the location from where trochlear nerve is generating. And fun fact is that it is the smallest cranial nerve, but it has longest intracranial course, which makes it vulnerable to trauma or compression syndromes, right? And it also fully decusates, which means that it crosses the fibers of opposite direction, opposite side fully. So let's talk about the course of trochlear nerve. So the fibers of cranial nerve for a trochlear nerve, they decussate in the superior medullary velum, a midbrain structure, right? And after crossing in that portion, the nerve exits dorsally from the brainstem, which makes it only cranial nerve that exits dorsally from the brainstem near the cerebellum, right? And after exiting from that location, it then curves around the brainstem, passes through the cavernous sinus, and enters the orbit via the superior orbital fissure outside the annulus of Zinn. So this is the course of the trochlear nerve, and its long course makes it vulnerable to trauma or compression. I had talked about it earlier too. The branches of trochlear nerve, there are no branches. It is a single direct motor nerve, not sensory, direct motor nerve from the midbrain to the superior oblique muscle, right? So the image attached in here contrasts between three different nerves here: oculomotor nerve, trochlear nucleus, and then abducens nucleus and their supplies, right? You can see trochlear nucleus is supplying superior oblique muscle, and abducens nucleus is supplying lateral rectus muscle. We'll be talking about abducens nerve in our upcoming episodes. So the functions of trochlear nerve is that it supplies superior oblique, as we have talked earlier, and the actions of this muscle is intorsion. It rotates eye inward, like towards the nose, and depression moves eye downward when adducted. Adduction, we have talked about the meaning of adduction, that it adds, like adduction means adding the structures to the midline, right? So the structures are moving to the midline of our body, right? So in summary, its actions is that it rotates eye inward and moves eye down, just like this. You can see, like when you are reading, it is the action of trochlear nerve that is happening right there. So comparison is with inferior rectus muscle, which depresses when abducted, in contrast to trochlear nerve, right? So let's talk about the lesions first. So the causes of these lesions can be trauma or congenital or compression, right? So in trauma, there is obviously long intracranial course, and congenital cranial nerve 4 palsy can happen, and in compression, tumors can compress the nerve, or increase in intracranial pressure can also compress the nerve. And the symptoms of these causes appear as vertical diplopia. Diplopia means double vision. Worse, it gets worsened when looking down, example reading, and head tilt is to compensate the disability of this nerve, right? So the patient with trochlear nerve palsy often presents with head tilt away from the lesion. If it has right lesion, it tilts the head to the left. Why is that? Because the fibers of right trochlear nucleus, supply to the left eye, left superior oblique muscle, because it decussates, right? So that is why it is opposite or away from the lesion in the head tilt. And if the lesion is nuclear, that is in central portion of the nucleus, then the contralateral eye is contralateral eye is affected. And then if the lesion is peripheral, ipsilateral eye, that is the eye of same side, is affected. So that is all about trochlear nerve. And subscribe for more clinical polls like this. Thank you for staying with me, and if you have any questions, you can comment it down. Thank you.